Health is critical to the development of every society as no nation progresses without sound and sustainable healthcare delivery system from primary to tertiary level. Medical doctors are a tool with which the health of the citizens is put on check. There are growing concerns over inadequate medical doctors in the country and Taraba State in particular. According to Nigerian Medical Association Taraba State branch, one doctor serves 17,959 patients instead of 600 patients per doctor as recommended by the World Health Organization (WHO). Dr. Adamu Hamidu Kara is a medical doctor with the Federal Medical Center Jalingo who doubles as the state chairman of the Nigeria Medical Association, attributed the shortage of doctors to some key factors.
Well, speaking about shortage of doctors in Taraba State, let me first say generally in Nigeria, uh, in the medical uh, sector, we are lacking doctors. Reason because most of our doctors trained in Nigeria has left the country looking for greener pasture. However, coming down specifically to Taraba State, Taraba State is one of the states that has least number of doctors in the country. I think currently we just have about 200 and somewhere, 211 or thereabout. I can't remember very well, but it's just 200 and some few numbers thereabout in the whole of Taraba State. So, and there are so many factors that contributed to the shortage of doctors in Taraba State, but I will mention some few major ones. Number one, let's talk about insecurity. You see, the issues of kidnappings and other insecurity related cases in the state has been high, and that has been one factor that discourages so many doctors from coming down to practice in Taraba State. However, we still need to applaud the governor of the state for the proactive steps he has taken in trying to address the issue of kidnapping in Taraba State. I would say now Taraba is fairly stable. However, that has been a major factor that drives away most doctors from the state. As a medical professional, for you to practice effectively, you need a very conducive environment that is safe. There is no kidnapping, there is no banditry, there is nothing, because you have to be stable in both mind, physically, and the environment before you can practice. So insecurity has been one of the major challenge. Secondly, another major challenge that leads to shortage of doctors in the state is poor infrastructure. When I talk of poor infrastructure, many of our hospitals in the states lacks the essential equipment that you need to use.
The doctor-patient ratio is poorly below average, according to Dr. Kara, and has negative impact to the sector.
Doctor-patient ratio also is a very big factor, but we hope that with time, if we are able to get more doctors in the state, that's going to lessen the work for the doctors, and working condition will be more favorable. And we have lack of incentives. As a doctor, if you are practicing, there are things that will keep you in a place. Medicine is something that you always want to improve. So if you are in an environment where you are given incentives like opportunities to train, to specialize, where your institution can support you to go for training, to become a consultant in various fields, to give you training facilities and opportunities so that you can grow. These are incentives that will keep doctors in the state, and it will also attract more doctors to the states. And because of the poor incentives we have, and then doctors are not given opportunities to train, I think these are other things that also lead to a small number of doctors. So most of the time we even have indigenous that will graduate and they will choose to work somewhere else.
State Commissioner of Health Dr. Bodia Buma sheds light on the reasons for the shortage of doctors in Taraba State.
Again, we are aware that the WHO recommendation is that one doctor takes care of 600 people. Now, I want us to know that the lack of doctors is not just a Taraba problem. It is not a Nigerian problem, but it is a global problem. Everywhere in the world, go to the UK, you see doctors migrating to the Canada, doctors migrating to Australia, doctors migrating to New Zealand. So it is a global problem. And this problem is as a result of so many factors. And some of the factors are not factors that we can control in the health sector.
The state government, under the leadership of Governor Agbu Kefas, is working round the clock to address the challenges confronting the healthcare sector.
So what it means is that the government is employing 450 because we are taking over the 300 staff that were being paid by Gavi and then employing additional 150 to make 450. So that is what the government is doing. In addition to that, we are renovating 113 primary healthcare centers across Taraba State. As we speak, more than 60 facilities, serious work has commenced in more than 60 facilities.
To this end, all hands must be on deck towards the increasing demand to change the narrative. There is also the need for policy framework in addition to increasing budgetary allocations to State Ministry of Health to strengthen students' scholarship in the area of medicine and surgery to fill in the gap. Ahmed Abubakar, Haske TV News.